Mild corona symptoms can be treated at home. Recommendations for caring for COVID-19. Patients at home according to WHO. Following are guidelines published by WHO and the Indonesian Ministry of Health, Directorate General of Disease Prevention and Control. 1. Place the patient person in a separate room that is well ventilated, with open windows or doors. 2. Limit movement and minimize sharing of the same room. Ensure shared spaces, such as kitchens and bathrooms, are well ventilated. 3. Other family members should sleep in different rooms, and if this is not possible, then keep a minimum distance of 1 meter from the patient, sleeping in different beds. 4. Limit the number of people caring for the patient. Ideally, one person who is completely healthy without other health problems or immune disorders. Visitors are not allowed until the patient is completely healthy and asymptomatic. 5. Perform hand hygiene, wash hands immediately every time there is contact with the patient or the patient's environment. Wash your hands before and after preparing food, before eating, after going to the bathroom, and whenever your hands look dirty. If your hands don't look dirty, you can use a hand sanitizer, while for hands that look dirty, you can use soap and water. 6. If washing your hands using soap and water, a disposable paper towel is recommended. If not available, you can use a clean towel and replace it immediately if it is wet. 7. To prevent transmission through droplets, a surgical mask, flat mask, is given to the patient to be worn as often as possible. 8. The person providing the care should wear a surgical mask, especially if he is in the same room with the patient. The mask should not be held during use. If the mask is dirty or wet, replace it with a new one immediately. Discard the mask in the right way, don't touch the front, but start from the back. Discard immediately and wash hands immediately. 9. Avoid direct contact with body fluids, especially oral or respiratory fluids, phlegm, mucus, etc., and feces. Use gloves and a mask if you have to provide oral or airway care and when handling feces, urine, and other waste. Wash hands before and after disposing of gloves and masks. 10. Do not use a mask or gloves that have been used. 11. Provide sheets and special cutlery for patients. Wash with soap and water after use and can be reused. 12. Clean the surfaces around the patient including toilets and showers regularly. Household soap or detergent can be used, then 0.5% NaCl solution, equivalent to 1 part bleach solution and 9 parts water. 13. Clean the patient's clothes, bed linen, towels, etc. using household detergent and water or washing machine with water temperature of 60-90 degrees Celsius with detergent and dry. Place in a special bag and do not shake, then avoid direct skin and clothing contact with contaminated materials. 14. Gloves and plastic aprons should be used when cleaning patient surfaces, clothing, or other materials that come into contact with the patient's body fluids. Gloves, which are not disposable, can be reused after washing with soap and water and decontaminated with 0.5% NaCl solution. Wash hands before and after using gloves. 15. Gloves, masks, and other waste materials during treatment should be disposed of in the trash can in the patient's room, which is then tightly closed before being disposed of as infectious feces. 16. Avoid contact with other contaminated items such as toothbrushes, eating and drinking utensils, towels, clothes, and bed linen. 17. When health workers provide home health services, always pay attention to PPE and follow recommendations for preventing disease transmission through droplets. According to WHO, the majority of patients with COVID-19 are adults. What about the symptoms? The most commonly reported symptoms include fever, dry cough, and shortness of breath, with the majority of patients, 80%, experiencing mild symptoms illness. Aka mild symptoms or illness? Well, this condition is what is allowed to be treated at home with the guidelines above. Then, what about the other patients? About 14% were seriously ill and 5% were critically ill. The WHO report shows that disease severity is associated with age 60 years and comorbid disease or chronic disease. For example, heart disease, lung disease, and kidney failure. Well, this condition certainly requires immediate medical care. In short, it needs to be treated in a hospital, not at home. Apart from mild symptoms, there are other considerations